So what is revision knee replacement? That lingo for an orthopedic surgeon means a second time surgery. There's a bunch of different second time surgeries that can occur. I think we first must explore, why do knee replacements fail? So if we looked in 1985, 1995, most knee replacements failed in those years, or when they were put in that year or those years, because the plastic wore out. Again, early 2000s, it was introduced, the newer modern plastic, which has now changed and flipped the reason that we're doing seeing second time surgeries. And so early on, second time surgeries, plastic wore out. And we still hear that a lot, but that's not true any longer. But it takes a long time for this modern information to disseminate out there. And so second time surgery can be something as simple as popping in a new piece of plastic, or we know those little plastic particles can get into the bone and cause the parts to loosen. And so maybe as the plastic wears out, the parts loosen. And so if we look at second time surgery for parts that are all loose, we have to change everything. And so it will depend on how your parts have failed that you will have your second time surgery. Second time surgery is a more extensive surgery in most cases. Certainly just replacing the plastic is quicker and simpler, but if we have to replace all of your parts, it's a much bigger surgery than the first go round. What I see in my practice, having only been in practice 8 or 9 years, is that a lot of my patients who have a second time surgery with me have an easier time than their first go round 20 years ago, because our techniques are better, our anesthesia is better, our pain control is better, because we have a bunch of different medicines we can use now. So certainly I see a lot of my patients who have a second time surgery with me have an easier go round in their second time knee replacement. You know, if we look at modern knee replacements, why are they failing? They fail for loosening for unknown reasons. We still have infection as a reason for parts loosening. And then we see that the bone can break above or the bone can break below. Ligaments still hold the knee together after knee replacement, and those can break. All of these can lead a patient to a second time surgery. You know, one important thing that happened 20, 30 years ago is the countries around the world started making registries. And registries are all of the joint replacements performed in that country are input into this computer or the computer program, and we can look at how those parts do. We now have this registry data that tells us how these parts are failing, how long it takes for them to fail. And the registry data suggests that at 20 years, you have a 5% chance of second time surgery. That's about 0.25 to 0.5% per year cumulative risk. Now what that means is you add this up and you get 5% at 20 years, and we feel pretty confident that we can extrapolate that to a 10% risk of second time surgery at 40 years. Now that's an extreme number for many of my patients, but certainly as the age of knee replacement goes down, those become important numbers. And so we're looking at somewhere about a 0.25 to 0.5% cumulative risk per year that you will have a second time surgery.